Hi guys, Tony Maritato here, physical therapist, and in this video I want to answer the question, what is the best possible sleep position after your total knee replacement? So that question is kind of an interesting question. The conventional advice that just about everybody is going to receive is sleep flat on your back with your heel propped so the leg is as straight as possible. But why are we giving that advice to so many patients? We're giving that advice because we want to use the opportunity to capitalize on sleep to improve knee extension. By keeping the leg straight, the knee is gonna stretch into extension. We're gonna get you to zero quicker, and zero is what we want. Zero extension is what we want to improve the quality of the way you walk. However, that is advice given in a vacuum. That doesn't take into account the individual who can't sleep flat on their back because of spinal stenosis, or the person who has a sleep apnea device and can't sleep on their back and they need to sleep on their side, or this, that, and the other, 1,000 other reasons why. As a physical therapist, the vast majority of my patients are unable to sleep on their back. Combine that with the fact that if you've had a knee replacement, you probably already know sleep is a rare commodity. Very few individuals after a knee replacement are sleeping well anyway. So here is the conventional advice. Sleep flat on your back with the heel prop to improve extension. Now here's the practical advice. Take any opportunity you can to sleep as soundly and comfortably as you can for as long as you can. Some of you, it might be 15-minute cat naps. Some of you, it might be 2 hours. If you're getting 7, 8, 9 hours of sleep, that's awesome. Like I'm literally speechless because I don't know in 20 years I've ever had a single individual who's getting 8 or 9 hours of sleep after a knee replacement. But that being said, let's keep that idea of practical advice going. So we want to improve knee extension. What opportunities in sleeping positions do we have to improve knee extension? Certainly, if you're a side sleeper, I can make a case that supports sleeping on the surgical side. So if you had your right knee replaced, you would sleep on the right side down. That would allow you to straighten that right leg. It's fully supported by the mattress surface, and perhaps you can sleep better in that position. Certainly if you're a stomach sleeper, sleeping on your stomach. If you've done therapy at all, you've probably heard of prone hangs. That's when we position the patient on their stomach and allow the leg to hang off the edge of the plinth, the mat, the bed. So sleeping on your stomach, if that is the most comfortable position for you, go ahead and do it. The implant is safe, the incision is safe, you're not going to damage anything. Of course, talk to your surgeon before you do anything, but most likely they're going to say, if your range of motion is improving and is on course for what is expected, then you pretty much have a green light to sleep in whatever position affords you the best rest and recovery. Sleep is required for so many things. This is a stressful event. If you're not sleeping well, you're not thinking well. We know that 1 or 2 nights of interrupted sleep, not even sleep deprivation, just interrupted sleep, will increase pain sensitivity. We know that interrupted sleep will wreak havoc on your blood sugar levels, even if you're not a diabetic. The body needs time to rest, and sleep is a huge component of that. If we can't get the best sleep possible, we're just not going to have, it's going to be an uphill battle to get back to the recovery and the things that we want to do. So summarize the conventional wisdom, sleep flat on your back with your heel propped. The practical wisdom, sleep in any position that allows you to rest. And if your knee range of motion is improving normally, don't worry too much about it. Use sleep for sleep. Use exercise and physical therapy to improve performance and function. But if you're having a hard time, if you're just not getting the knee extension you need, look at ways to put your knee in full extension while you're sleeping on your side, on your stomach, with the surgical knee on top, with the surgical knee on the bottom. You can always find a position that allows the knee to go straight while you sleep to take advantage of any opportunity you have to get a restful sleep. Guys, I hope this information was helpful. please post your questions in the comments below. Your questions produce these videos, and the more questions you ask, the more videos I can produce. I'll see you guys on the next one.